In this video, you'll get a quick overview of Vibrant's whole blood nutrient profile. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. More than 2 billion people suffer from micronutrient deficiencies worldwide. Micronutrients play a vital role in energy production, hemoglobin synthesis, maintenance of bone health, adequate immune function, and protection of the body against oxidative stress and cellular aging. Assessing nutrient levels helps determine root causes of malnutrition and inflammation. Therefore, uncovering micronutrient deficiencies is an easy and critical step in addressing chronic conditions and healing. The whole blood nutrient profile measures levels of vitamins, minerals, antioxidants, metabolites, and amino acids, and also has an optional fatty acid add-on for deeper insights. Vibrant's whole blood nutrient profile is an at-home blood test collected via microtube. Fasting is not required, and there are no dietary or medication restrictions. However, ordering providers may decide at their clinical discretion whether to test patients under supplemented or non-supplemented conditions. Vibrant's whole blood nutrient profile uses multiple methodologies, including the gold standard ICP-MS for metals minerals and LC-MS for quantitative detection of most other micronutrient markers. These methodologies are powerful analytical techniques that combine the separating power of inductively coupled plasma and liquid chromatography with the highly sensitive and selective mass analysis capability of quadrupole mass spectrometry. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and full report. Let's start with a quick overview. The whole blood nutrient profile sample report is 7 pages long and includes a cover page, a summary which highlights all markers that are out of range, and then lists all markers. Note there are no interpretive comments for Vibrant's whole blood nutrient profile. The cover page lists the sample type and the results interpretation key. The introduction page introduces the methodology and interpretation of report, and I highly recommend reading this page, especially the part where it says, reference ranges have been established using a cohort of 1,000 apparently healthy individuals, and also the part where it says, the classification of red indicates a result that is outside the reference range, and the classification of green denotes a result that is within the reference range. As I mentioned before, the summary highlights the micronutrients that are outside of the reference range. In this example, the patient's vitamin B3, vitamin C, and omega-6 to omega-3 ratio were all out of range. And the full report lists levels of all the micronutrients organized into the following panels: amino acids like glutamine and leucine, antioxidants like glutathione and selenium, metabolites like choline and methylmalonic acid, or MMA for short, minerals like calcium and iron, and vitamins like folate and vitamin C. If you add the whole blood omega fatty acids, it will appear at the end of the report. And note, the whole blood omega fatty acids is an add-on test and not automatically included in the whole blood nutrient profile. The results are reported as both a number and plotted graphically so you can visually see how high or low your patient's results are. In general, conditions, signs, and risks associated with micronutrient deficiencies include fatigue, stress, lack of concentration or brain fog, depression or anxiety, numbness or tingling in extremities, a weakened immune response, stubborn weight gain, unexplained weight loss, skin problems, or digestive disorders with malabsorption, including celiac disease, Crohn's, ulcerative colitis, and small intestinal bacterial overgrowth. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one doesn't necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. Therefore, tests that pair well with Vibrant's whole blood nutrient profile include the gut zoomer, to test for microbiome, inflammation, digestion, and malabsorption-related influences on nutrient status. Also, the wheat zoomer to assess for increased intestinal permeability, aka leaky gut, celiac disease, and gluten and wheat sensitivity, all of which can impact nutrient status via malabsorption. On that same line of thinking, food sensitivities, which may be a sign of leaky gut and poor digestion. And finally, the total tox burden, which includes mycotoxins, heavy metals, and environmental toxins. As toxins increase utilization of many nutrients, as antioxidants are upregulated to quench free radicals from toxicant exposure, and also in a catch-22, poor nutrient status can increase intestinal permeability and impair detoxification pathways, which, in turn, can increase total toxic burden. In summary, Vibrant's whole blood nutrient profile measures levels of vitamins, minerals, antioxidants, metabolites, and amino acids using gold standard LC-MS-MS and ICP-MS methodology, helping you uncover the root cause of your patient's symptoms so you can create personalized treatment plans to resolve their nutrient deficiencies, address chronic conditions, and improve their overall health. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.